Hi guys, welcome to the channel. My name's Matt and I'm a paramedic based in the UK. And today we're going to be talking about what to expect in the day of a life of an ambulance worker and how you can practically make steps towards getting into the ambulance service this year. Whether you want to start it as an emergency care assistant or as a full-fledged paramedic, this video will introduce everything you need going forward. First role we want to talk about is the emergency care assistant, or ECA. Now this is a great role to start with, because it lets you build up your clinical skills, your clinical knowledge and your patient communication skills without any direct autonomy or responsibility placed on your shoulders. You'll learn lots from working with paramedics and EMTs, and your role will be to assist them in the assessment, treatment and diagnosis of patients. This may involve performing basic observations on patients and assisting the paramedic or EMT with their assessment. It will also involve providing life-saving intervention to patients who are critically unwell. You'll also have a lot of driving responsibility and will be asked to drive on blue lights both when conveying an unwell patient into the hospital and when responding to an emergency call made by the member of the public. The next role we want to talk about is the emergency medical technician, or an EMT. Now it's important to note that this job is also known as an AAP, an Associate Ambulance Practitioner, and this title is becoming more and more popular throughout the UK. Now working as an EMT is a big step up from being an ECA, because you start to make independent patient decisions and have a lot of clinical autonomy. You'll have access to drugs you can give to the patients, either life-saving drugs or some pain relief, and you also can start to manage patients in the community and use some of those extended pathways we have in the ambulance service to make sure the patient gets the best quality of care. Working as an EMT will also give you a great foundation if you want to move on to become a paramedic. You'll become familiar with drugs, making patient decisions and having some autonomy on the ambulance. Now the final role we want to discuss is that of a paramedic. The paramedic will often be the clinical lead on board an ambulance and will have a lot of autonomy to assess and treat patients in line with their clinical judgment and following their practice guidelines. They'll be able to provide life-saving interventions as well as deliver some life-saving medication to patients who require them in critical circumstances. They also can assess and come up with alternative treatment plans for the less sick patient we encounter in the ambulance service. This may involve referring them to a community service, a different service within the hospital away from the emergency department, or keeping the patient at home and managing them with some community pathways, perhaps involving the GP. Your training will allow you to assess patients fully and comprehensively, and this training can actually build a base for moving on to more advanced roles. More and more paramedics are working in GP services, as well as in hospital working in A&E and intensive care. There's also roles outside of the hospital you can progress into, such as management or onto critical care services such as the air ambulance. Now before we get into different ways of getting into the ambulance service, I want to talk a little bit about the day-to-day activities in the ambulance service and what you can expect from a shift working on an ambulance. Now there's a little bit of a misconception about what we go to on a day-to-day basis in the ambulance service. A lot of people think that we attend car crashes, major trauma, cardiac arrests, heart attacks all day, every day, but the reality is that isn't true. Of course, attending those emergencies is part of the job as well, and you never know what the next call is going to be. So you need to make sure that you're up to date with your knowledge and your clinical skills, so if you do attend a proper emergency, a life-threatening situation, you can treat that patient properly and give them the best standard of care. But just consider that isn't going to be the day-to-day basis of the job. Now, attending non-emergencies is by no means a bad thing. You can still provide a detailed and excellent level of care to the patient. But just understand and realise that a lot of the work you'll be doing is not emergent, and you have to hone your skills to be able to deal with all patients you encounter. Now you're probably wondering, how do you actually get into the ambulance service? How can you start your career this year? The first option you have is to go into the ambulance service as an ECA, a trainee ECA, and follow essentially an apprenticeship pathway right up to paramedic. Now some ambulance service trusts will take you on as a trainee ECA, provide you that essential training and ask you to do some time on the road as an ECA before progressing you on to becoming a paramedic, and that may involve supporting you through your university studies. This might be a good option for you if you want to take your time when progressing through your career in the ambulance service. You'll have years and years and years of clinical experience and experience dealing with a variety of patients before progressing on to become a paramedic. Another option you can look at is to go directly into the ambulance service as a paramedic. Now, to do this, you'll need to complete a degree or a degree equivalent in paramedic science or something of a similar title. This is an undergraduate degree, a BSc normally, and will allow you to register as a paramedic with the HCPC, which is our registry body as UK paramedics. The degree normally takes around 3 years and will be a combination of teaching in the classroom, where you learn everything from anatomy, physiology, and practice your clinical skills in simulated environments. So you're actually going out on the road in an ambulance as a student paramedic and practicing your skills on real patients. You'll also have specialist placements in hospitals and maybe in community services such as GPs. And the final option that isn't so commonly known is to follow a private route. Now, there is a pathway called the First Response Emergency Care Pathway, where you can pay for courses and essentially progress yourself up through the ECA level to EMT to paramedic. There's a huge private world in the ambulance service in the UK, particularly in the south of England. So if that's something you're interested in following, it can get you into the ambulance service a little bit earlier and get you some exposure from the onset. It will also suit you well if you're looking to change career and have a little bit of money to put towards those courses. Working in the ambulance service can be extremely rewarding, but also can be very emotionally taxing. We've talked about a variety of different ways of getting into the ambulance service today, but the reality is it's very individual based on what your experience is and how you want to approach your career. Following the ECA apprenticeship or FREC route will give you years of experience and exposure to clinical situations and allow you to build up your patient confidence slowly and gradually. But if you're someone who's a quick learner, has experience and is confident dealing with members of the public and can work well under pressure, maybe choosing the paramedic university route is the best option for you. Make sure you like, comment and subscribe if you want to learn more about getting into the ambulance service, and tune into the next videos where we'll explore each option in more detail. Thanks for watching, we'll see you in the next video.